might be saying. Okay, let me bring in our health and science reporter, Sada Hassan, for the latest on malaria vaccine uptake, as well as the COVID cases in the country, even as fears of a sixth wave linger. Sada Hassan, it's great to see you. These are definitely tough times. It seems we should still keep our awareness really high since there's a possibility of a sixth wave. What do we know so far?
Absolutely. Good morning, JC. So as much as right now we are into the political season, the most important thing is for us to ensure that we still maintain our guard, because according to the latest report from the LREB region, that is the Lake Region Economic Bloc, it shows that there's a possibility of a sixth wave, bearing in mind that we still have people gathering, we still have politics ongoing, and with people moving up and about without wearing masks. All the cautionary measures that were put in place before are right now not being adhered to. So it is quite a critical season, especially right now with politics, with campaigns all over the country. But importantly or interestingly, you will note that there are few individuals still putting on their masks. For example, during the last games over the weekend, we saw some government officials still wearing their masks, like the First Lady. And it shows that as much as most of us have forgotten about COVID-19, there's still particular people who are still taking note of the danger that COVID-19 can bring to an economy or to a family, and that is why they're still taking on the measures necessary to ensure that they don't get COVID-19. And remember that this is a virus that keeps on replicating itself, and the latest results shows that this virus is still replicating itself and trying to ensure that it becomes bigger and better in order to survive in different regions, because that is the only way it can continue to manifest itself in people, in different surfaces. And that is the only way a virus can survive and keep on continuing with this COVID-19 pandemic. And that is why as a country we still need to ensure that we maintain our COVID-19 regulations and, wear the mask, wash our hands as much as possible, use sanitizers. And that is why this is a story that we are still keeping our eye on. But apart from that, we also have the malaria vaccine story. We know that the clinical trials of malaria vaccine, the RTSS, ended some time back, and the first batch of the vaccine was deployed in some particular regions in Kenya. But the uptake has been quite slow compared to what was expected. We have about 45,000 children who have been vaccinated with at least 2 doses, because the first dose is supposed to be administered at 6 months, the second one at 7 months, and then consecutively it follows, because they're supposed to get 4 doses that's supposed to be given to a child. So the uptake has been a bit slow compared to what was expected, but it is important for us to keep on encouraging Kenyans to ensure that their children are vaccinated, because malaria remains a big problem. It remains a big disease that annually we have a number of children dying, a number of people dying. And this is a disease that is quite common in some regions along the lake, like Siaya, Bungoma, Kisumu. And because mostly this is a region that is a wet area, and you know that mosquito, the mosquito thrives in areas that are wet, that are particularly convenient for it to lay its eggs and continue thriving. So this is a story that we will be following up at the end of the day.
Okay, a lot to talk about when it comes to health, so we still need to keep our guard up even as the political temperatures are heating up in the country. I'm pretty sure there'll be crowds, and I hope our numbers, by the way, how are the vaccination numbers? Are Kenyans still turning up to be vaccinated?
Is quite low. So far, we have administered about 17 million vaccines. 16 million have at least attained the first dose of the COVID-19 vaccine. But if you compare this vaccine uptake to last year, when we were coming to an end of the year 2021, there was a rush during that period, and we saw that about 200,000 doses could be administered in a day. But right now, the situation is very different. You will find that in a day, less than 100,000 doses have been administered, which is quite critical, is quite not appealing, because When we look at booster doses, only about 300,000 Kenyans, 300,500 Kenyans have taken the booster doses, and some time back, this was an issue that was really emphasized by the Ministry of Health, that Kenyans should take their booster doses if you got the first 2 jabs of COVID-19 vaccine. So we see that the uptake of vaccine has really gone down, and this is a matter that Kenyans are no longer putting in so much interest into it compared to maybe last year, when the government was really aiming to hit at 10 million vaccines administered in the country.
Interesting. So we definitely hope the vaccine uptake numbers go up. Thanks for that update, Sada Hassan, with the latest on what the Health and Science Desk will be following up for us in the course of the day. So away from health matters, let's take a look at what Kenyans are talking about